If I asked you to close your eyes for a moment and remember the last time your body felt quietly strong, not rushed, not forced, but steady and reliable, you might find that memory comes from years ago, somewhere before joints began negotiating every movement, before muscles started retreating instead of responding. And yet, here is the remarkable truth that modern science keeps whispering to us. Even as aging tries to shout it down, your body has not forgotten how to rebuild itself. It has only been waiting for the right signal. Not more strain, not more sweat, just the right message. Today, I want to talk about one simple movement. It's one deeply human motion that sends that message louder than the gym ever could. As a surgeon, I've spent decades with my hands inside the architecture of the human body. I've seen muscle fibers frayed by neglect, starved by fear of movement, misunderstood as something that simply disappears with age. And I've also seen something far more hopeful. I've seen muscles in people over 60 respond, not explosively, not dramatically, but intelligently. It's when they are approached with respect instead of force. We were taught, for a long time, that muscle growth belongs to the young. That rebuilding strength requires heavy weights, intense repetition, and a willingness to push through discomfort. But the aging body does not thrive on aggression. It thrives on precision, on timing. A muscle is not just tissue, it is conversation. Every movement you make sends a message down your nerves, into your muscle fibers, and back to your brain. Most exercise shouts. The movement I want to share today speaks calmly, and the body listens more closely. When people hear rebuilding muscle faster than the gym, they imagine some hidden trick, some shortcut that bypasses biology. But there are no shortcuts, only overlooked pathways. And one of the most powerful pathways is something we perform dozens of times a day without thinking, until we stop trusting our bodies enough to do it well. The movement is the slow, controlled lowering of your body from standing to sitting, not falling into a chair, not collapsing, but lowering yourself as if gravity were something you could negotiate with rather than surrender to. At first, this sounds almost insulting in its simplicity. How could something so ordinary rebuild muscle? But the human body does not measure effort the way we do. It measures tension, time under tension, and most importantly, control inside your thighs, hips, and core lev muscle fibers that respond especially well to what science calls eccentric contraction. This is when a muscle lengthens while under load. It is the opposite of lifting a weight. It is resisting gravity rather than overcoming it. And fascinatingly, eccentric contractions stimulate muscle rebuilding more efficiently, with less strain on joints, less inflammation, and less risk of injury. As we age, our nervous system becomes more cautious. It prioritizes safety over power. That's not weakness, it's wisdom encoded into biology. When you attempt heavy gym exercises, the nervous system often applies the brakes. It senses threat. But when you perform a slow, controlled descent into a chair, something different happens. The nervous system relaxes. It allows deeper muscle fibers to engage. It says, this is safe, this is familiar. And so the muscles respond. So what's happening beneath the skin is quiet but profound. Muscle fibers are being asked to coordinate, not just contract. Balance systems in the inner ear and feet are activated. The brain maps the movement in fine detail. Blood flow increases locally, delivering oxygen and nutrients precisely where repair is needed. Hormonal signals shift subtly, favoring maintenance over breakdown. This is not exercise as punishment. This is exercise as communication. I've watched patients in their 70s and 80s regain strength using this single movement, not because it exhausts them, but because it teaches their body to trust itself again. Strength is not just force. Strength is confidence at the cellular level. When muscle fibers sense controlled load, they initiate repair processes. Satellite cells, tiny helpers that live alongside muscle fibers, wake up. They donate nuclei to damaged fibers, reinforcing them from within. This process does not require maximal effort. It requires consistent, meaningful stimulus. And here's the part most people miss. Muscles rebuild not during effort, but in response to it. When effort is too extreme, the body diverts resources to inflammation and protection. When effort is precise, the body invests in adaptation. The slow sit-down movement provides exactly that precision. There is also a philosophical lesson hidden here. Aging often teaches us to rush less, to choose care over speed. This movement mirrors that wisdom. It asks you to slow down, to feel each inch of descent, to remain present in your body rather than escaping it. Many people over 60 unconsciously stop trusting their legs. They rely on momentum. They push with their hands. They brace for impact. Over time, the muscles interpret this as disuse. They retreat further. A quiet cycle begins. Less confidence leads to less use, which leads to less strength. This single movement interrupts that cycle. When performed slowly, 5, 6, even 8 seconds on the way down, the muscles of the thighs, hips, and core are engaged continuously. The knees are supported rather than compressed. The spine remains aligned. The breath stays calm. And the brain records the experience as success. This matters deeply, because the brain governs muscle more than muscle governs itself. From a surgical perspective, I've seen how fragile recovery becomes when muscles are ignored. I've also seen how resilient the body can be when given the right kind of stimulus. Muscle loss with age, what we call sarcopenia, is not inevitable. It is responsive, but only if we stop trying to train an older body as if it were a younger one. The gym environment often prioritizes intensity over intelligence, loud effort over quiet control. But the biology of aging prefers the opposite. This movement can be done anywhere: a chair, a bench, the edge of a bed. What matters is attention. You stand tall. You shift your weight evenly through your feet. As you inhale gently, and then you lower yourself as if you were carefully placing something precious down, because you are. The muscles work hardest not at the beginning, it's not at the end, but in the middle, where control is most required. That is where adaptation happens. That is where rebuilding begins. And when you stand back up, using only as much assistance as needed, you complete a full dialogue with gravity. Over time, that dialogue becomes fluent, confident. There is something deeply human about this. Standing and sitting mark independence. They mark dignity. They mark the ability to engage with the world without fear. When those movements weaken, life shrinks. When they strengthen, life expands. Science often advances by rediscovering what the body already knows. We evolved not in gyms, but in environments where control mattered more than force, where getting down and up safely determined survival. The slow sit-down honors that evolutionary wisdom. It also respects the joints. Eccentric loading produces less joint stress than explosive lifting. For aging knees and hips, this is not a small detail. It is the difference between progress and pain. And there is another layer here, one we rarely talk about. Fear. Fear of falling. Fear of pain. Fear of discovering limitation. Slow, controlled movement teaches the nervous system that fear is unnecessary. It rewires expectation, and expectation shapes outcome. I've seen patients reclaim strength not just in their legs, but in their posture, their walk, their willingness to move through the world again. Thus, muscle rebuilding is never just physical. It is psychological. It is emotional. It is relational. You begin to relate to your body not as an adversary, but as a partner. So this is why one movement can outperform hours in the gym, not in raw numbers, but in relevance, in sustainability, in alignment with how the aging body actually heals and adapts. You do not need to chase exhaustion. You need to invite engagement. Perform daily, slowly, attentively. With patience, this movement sends a clear signal these muscles are needed. And the body responds to need. It responds quietly at first. A little more steadiness, a little less reliance on the arms, a subtle confidence when standing up. These are not small victories. They are foundational. Strength built this way lasts. Because it is integrated. Because it belongs to movement patterns you actually use. And perhaps most importantly, it restores something we rarely measure in medicine, but always feel when it's gone: trust. Trust in your legs. Trust in your balance. Trust in your body's ability to adapt even now. So if you take anything from this moment, let it be this: rebuilding muscle after 60 is not about fighting your body. It is about listening to it more carefully than ever before. One slow, deliberate movement can awaken systems that years of forceful exercise may have silenced. Tonight, tomorrow, and every day after, choose control over intensity. Choose patience over pressure. And if this perspective helped you see your body differently, if it gave you hope grounded in science and respect, then take one small action now. Practice the movement. Share this message with someone who has quietly stopped trusting their strength. And stay connected, because understanding the body is not a destination. It is an ongoing conversation, and I invite you to continue it with me.